Hi, my name is Matt Schreiner. I'm the owner of BrightStar Healthcare in Lafayette and Oakland, and been doing this business for about 5 years now. One of the things we run across out in the field, seeing everybody, is there's a huge variety of what goes on, what people call home care. Home care can be anything from a group of caregivers on Craigslist all the way to a specialized agency insured and bonded properly. So I was going to ask some questions or I'd like to introduce Jennifer Williams. Jennifer, go ahead and introduce yourself.
My name is Jennifer Williams. I'm the Director of Care Management here at BrightStar Care in the East Bay. And my background is in gerontology. I have a master's in gerontology. I'm also a certified geriatric care manager. And we're happy to share some information with you about how you can differentiate between what's a referral agency and what's an agency that employs their caregivers, and the pros and cons of each.
Obviously, we have some strong opinions on this, but when you look at care providers, they can come into 4 different categories: home care agencies, employment agencies, registries or brokers, and independent contractors. Jen, can you maybe talk about some of the way home care agencies screen and accept responsibility for employees versus these others?
Home care agencies typically do an interview process with the individual. Then they do a reference check for former employees. They also do reference checks with people that the individual knows. They also do some do drug screening checks as well. They do criminal background checks and driving checks to make sure there are no offenses on the record. They also pay the payroll taxes for the individual. They insure the individual and bond the individual so that if anything happens in a home situation, all the liability falls to the home care agency and not to the client who is employing the caregiver.
And how do agencies like that supervise their staff typically?
Typically, in an ideal world, all would supervise their staff every 30 to 60 days in the home to see what type of care that they're providing, see what documentation that they're using, and make sure that their competencies and skills are to the standard that the agency holds them to.
Great. And just to there's a variety in how people supervise it. There are some people that are owners that are doing the supervision. I think the best way to do it is with a director of nursing that has experience, that is a registered nurse. Also with a master trained care manager that is a certified, or care manager certified. Okay, can you tell me a little bit about what the difference is? What are some of the advantages and disadvantages of a referral agency?
Okay, well, a referral agency or an employment agency, they'll typically interview the individual and qualify them as a candidate who has the skills to do the job, but that's where their screening ends. They won't generally do a background check on the individual, nor a driving check. That will be the responsibility of the client who hires that person. But the referral agency might check to see if they have a first aid or CPR certification, might do a few reference checks, and that's about where it's limited. They're not able to provide that individual with workers' compensation insurance nor liability insurance. So it really, everything falls then to the client who's going to hire that person. And essentially, and how that differs from an actual independent contractor, say someone you get from Craigslist, or a referral from a friend, there's no screening that's done with an individual like that. So that person is being hired blind, and it is a really good idea to go down to a police department to see if your local police department will do a background check on that individual, if that's possible. So, and then also get a rider on your homeowner's insurance, and become the employer through a payroll service, so that you're protected in all areas.
I think what Jen's showing is there is a lot of responsibility to take on if you're going to take on an independent contractor or a registry employee, in that you become the employer, you take on the responsibility for any injury in the home, anything that would happen with that employee, and you also don't necessarily have the backup staff that an agency would have. That's one of the advantages of an agency. If And it does happen when someone calls in sick. There's trained staff and a plan of care in place to be able to step in and help out in a time of need. And I guess that leads to, how do, does an agency representative along with a client family develop an individualized plan of care? You want to talk a little bit about how we develop plans of care?
We develop plans of care in conjunction with a family member who might have been providing care prior to us being there, also with the client themselves who's going to be receiving care. It's important to involve the client to the greatest extent that they can be involved in their own plan of care. That will enable them to be, the care plan to be executed more successfully and make the individual feel like they're part of the situation and not just someone who's getting cared for. So we'll give them, it'll support their autonomy more. So we have our registered nurse who develops a plan of care. I also do consulting on that. If there are other community resources that can be utilized in addition to a home care company, then we, by all means, try to suggest that to the family. So things such as resources such as Meals on Wheels, adult day health centers, other community programs where the seniors can interact and socially with others. Those are always encouraged to develop a holistic plan of care for that individual. It also might include the family members as well. So. And we're just, providing a piece of that. So we like to have a very comprehensive plan of care that involves different players, if that's appropriate for the situation.
And as Jen was saying, I think it's so important. In the reality, in 5 years in business, almost everything we do has both a medical and a social component to it. The reality is that nurses do the medical component better than anybody. They see a house in a different way than I do, even with 15 plus years of experience in healthcare. They see it in a slightly different way than Jen does. A gerontologist, in my mind's expertise, comes in the social aspects of aging and in understanding the resources and other things that are around. And if you can, I think one of the advantages of BrightStar East Bay is that we have both. We have a very strong care manager as well as a very strong director of nursing, which gives us an advantage. So how often are caregiver services monitored? Does an agency representative make regular visits to the client's home?
An agency representative, in most home care agencies, unfortunately does not, well, in some home care agencies they do. Ideally, in home care agencies, a representative from the company would be either talking with or visiting the client every 30 to 60 days. The standard in licensed home health care, which is medically based, the standard is 60 days for home visits. That said, if there's an incident, say there's a fall in the home or there's a change in status, that could necessitate an earlier visit than the 60 days. So we just like to keep in close contact with the family or the caregiver that's in the home to let us know and alert us of that, of a change in status.
Does the agency adhere to state and federal guidelines in their employment practices, such as withholding appropriate taxes, providing workers' compensation, and other benefits? I think you've alluded to this question before, but what do you think of that, I guess, as opposed to registries?
Well, with a home care agency that employs the caregivers, you can be assured that the payroll taxes are being paid by the employer and by the employee. That's not necessarily the case with a registry home care company, nor with independent contractors. I think it's encouraged in those situations, but it's not always followed through, and that can leave the client, who is then the employer, open to risk that they might not be aware of. So,
I think one of the things Jen just mentioned, I think, is so important, is that the follow through of companies varies. I mean, I think there is if there's 100 out there, there's maybe half a dozen that do this really well, or that attempt to do it really well. And in my mind, you have to have a supervisor. I think it's best to have a director of nursing and a gerontologist, but other agencies have gerontologists, some have just nurses, some, some have some combination of other things, but supervision is important, plan of care is important, the way the agency is set up for employment and workers' compensation is obviously important, and then the criminal background checks is not only saying you're doing them, but actually making sure that it's done on every single employee before they ever get anywhere near a home. And that's actually one of the reasons why at BrightStar we invited Joint Commission accreditation. Joint Commission accreditation, I believe, is the highest standard there is for home care right now. The Joint Commission has been around for, I'm not even sure how many years, but it has basically started as a hospital accreditation body and has been very tough in getting hospitals, clinics, and things like that to adhere to standards. They've now moved to home care. BrightStar believes that adhering to the highest standards is going to make us better. So when it's like inviting a root canal in some ways, but what their essentially Joint Commission accreditation is, we're saying we actually do what we say we do. They will come in and check that we're doing our criminal background checks, that the TB skin tests are done, and all those appropriate things are in place.